All right. So, to be respectful for everyone's time on this beautiful afternoon, thank you for joining us here from the Doctor of Occupational Therapy program at the University of Wisconsin-Madison. We're really excited that you've taken time out of your day to join us and learn a little bit more about our program. So, hello again. I am Dr. Alexia Rebney. I am the admissions coordinator and a clinical assistant professor for our program. I also have a number of other folks joining me today who will be able to share their expertise and areas of practice. So to begin, on the next slide, you'll see we have our program director here with us today, Dr. Sharon Gartland. So I will have Sharon introduce herself in a moment. We also have a number of administrative contacts that you might come in contact with if you contact our program. And so Ariana Murphy and Rebecca Gray both serve in various administrative roles within our program. So if you contact our OT office or if you reach out to our teams, you might receive responses from either of them. And then Dr. Gartland, would you like to say hello?
Yeah, welcome everybody. We're thrilled you're looking into occupational therapy here at UW-Madison. Do you want me to introduce myself a little bit? Or
Sure, that'd be great.
Yeah, I've been the program director here for the last 4 years or so. But I also have a lot of years as a practicing clinician in pediatrics in the schools and birth to 3 and outpatient clinics and inpatient rehab setting. So it's a profession I love. I've been involved in it for about 38 years, and also taught for many, many years, 25 years. So welcome.
Wonderful. So Dr. Gartland will lead us then in the next few slides to share a little bit more about our program.
Yeah, we just like to let everyone know that we have a long history, as you can tell from these lovely ladies in their pinafores. We've been around for, it's actually now almost 80 years. We have been a top ranked school in occupational therapy, as well as as a whole. UW-Madison is a top ranked school for many, many years as well. So we have just a long history of excellence. We are very competent at training students and getting to the point that they're ready to pass what's called the NBCOT exam, and we've been on a roll with 100% pass rate since at least 2011. We have, again, because we've been around a long time and are well respected, we have a number of sites available for clinical training, a lot of places that want our students and want to partner with us. And we have some great alumni and great faculty, so really proud of that. Next slide. Just a quick overview of our program, and I encourage you to check it out more in the on the website. But our program takes 3 years, and it begins every year in June. We're shooting for a class size of around 32, although that can vary a bit because it's a little bit of a game of figuring out applicants and acceptances and all of that. Our current cost of tuition is $1,000 a credit, and it's a total of 97 credits over 3 years. And then plus student fees. And we have a very significant amount of scholarship support. So don't let that completely freak you out. We particularly have support for local students that are in Wisconsin or Minnesota, where we have reciprocity with you. So that's just, if you look at the bottom, we've got some of those stats spelled out for you. Next slide. We have designed our curriculum very intentionally around 4 major areas of focus. As you can imagine, the main area is practice. Then we also, because we're at a research heavy university and we have many of our faculty are involved in research and are funded for their research. So that's one of the things that we feel is a real strength of ours, and students who come in our program get to be hands-on in those sorts of activities. I'm gonna out Emelina, who's one of our students here. She's just literally back from Denmark because she's helped present with one of our research professors at an international conference. So along with a couple of other students, right? And then we also have leadership and wellness as other threads. Leadership is the distinctive difference between a master's and a an OTD. And so we are particularly looking for students that want to grow and eventually think about being leaders in the profession. And then wellness is really unique to our program. And we'll talk some more about each of those threads in the next slides. So next slide. Thanks.
Yes, thank you. So to begin discussing a little bit more about our courses that are included in our OTD program, Dr. Gartland mentioned our practice thread. And so we have a number of us who contribute to the curriculum and practice where we've all been practicing OTs and have worked in various areas of clinical care and worked in various management roles and have held different positions that we can bring to the classroom. And so you'll get a chance to hear from Dr. Robinson here in a moment. But we also have Dr. Zarowski, who teaches in our pediatric curriculum and leadership skills program. We have Dr. Pilturak, who also teaches a lot of our practice skills courses, primarily for our adult curriculum, and Dr. Rortved, who you'll also have a chance to meet here in a few minutes, who also teaches in our practice thread in addition to our capstone coursework. So on the next slide, you'll see a photo of some students engaging in various activities in the classroom. And so we have different opportunities for hands-on learning. We have different opportunities where students are able to enter into the lab classrooms. Again, we mentioned our cohort size roughly 30, but in those lab experiences, the students are broken down into roughly 15 and 15. And so, or 16, depending on the class size. So again, it's a small cohort model where in those lab classes, you're getting a ton of hands-on experience where we have individuals coming into those lab classrooms with various needs. We have labs where families are bringing children for baby lab and for, again, just a lot of opportunity for hands-on learning. In addition to our pro bono clinic, which is a free clinic that we have on campus, that is an interprofessional opportunity with speech and language pathology and physical therapy students, with Doctor of Occupational Therapy students together providing care. So in these practice courses, we are preparing students to practice occupational therapy. It is a major component of the curriculum at 44 credits. On the next slide, you will see that we also have a number of courses that focus on fieldwork. So I'm going to let Dr. Robinson take it away here for a moment.
Hi, everyone. It's so nice to meet you. I'm Dr. Robinson. I'm the academic fieldwork coordinator at UW-Madison. And so with our program, we have 3 level 1 fieldworks. So our first one will occur in the your first spring, and that is adult phys dis, and we run a pro bono clinic. So all of our students participate in that, which is some of the photos that you can see here. And you will participate in that for 2 semesters, and one will be part of your level 1 fieldwork. We have a level 1B, and that is in mental health. So you will work in groups and go to community-based mental health settings across the summer. And then you have a third one in pediatrics, and that will happen in your second fall. That will be a 1-week placement where typically just you or maybe one other person will go to a site for a full week. So that talks about our level 1 fieldworks. And then for level 2, that is the traditional 2 12-week fieldworks or 3-month opportunities. And we actually just wrapped up our first doctoral cohort. Everyone passed, and that was really exciting. So I'll be the one that helps facilitate most of your level 1s and your level 2 fieldworks as well. And so on the next slide, I'll talk a little bit about just some of the practice areas that you might see within our program. So we have a lot of hospital-based placements and school-based placements, and we are continuing to build our community-based and our role emerging or specialty-based. So this list isn't all-encompassing in terms of what you might see on fieldwork, but just gives you a little bit of an idea. So in terms of hospital-based, we have acute care, inpatient rehab, we have plenty of outpatient rehab as well. We have some pediatrics and adults for both the hospital-based placements in terms of acute care as well as outpatient. We have a lot of school placements. We also have a few specialty school placements as well that might take predominantly autistic children, or we might have some smaller classroom placements as well. We have a lot of community-based, so outpatient peds is a popular one. We have a lot of outpatient hand placements that we work with. We have some long-term skilled nursing facilities. We have a group home placement as well. And then a few exciting ones that we do partner with a local forensics and prison system. And so that is a mental health placement that we work with. And we just continue to keep building on some role emerging and specialty placements. And then on the next slide, what I want to show you is just an overall map of what some of these placements look like. And so we have over 180 contracts with places across the United States. So we have quite a bit in Wisconsin. And so typically that's the Madison area. And if you're familiar with Wisconsin, we also have some in Milwaukee or Waukesha area. We have a few up in Stevens Point and Green Bay as well. And then we have quite a few in Minnesota, quite a few in Illinois, and then a few sprinkling around the coast. So you can see we have some in Washington, we have some in California. As you go south, Arizona, Texas, and then moving towards the east, we have a couple in Maryland as well. And so you work with me as we work on just deciding what placement would work best for you. And it's really exciting opportunity for all of our students for both level 1s and level 2s. And I'll pass it back on to Dr. Rebney to talk about research.
Yes, thank you so much, Dr. Robinson. Very exciting with field work. And so as Dr. Gartland was mentioning at the start of our webinar, we do have an extremely strong faculty of researchers who are generating the evidence that is defining how we assess and how we practice as clinicians, how we disseminate information. And so we're really fortunate to be at an R1 research institution where we're able to have opportunities to learn from those who are generating the data and analyzing the data, and as I mentioned, disseminating. So we have researchers who are renowned here in the United States and beyond. Just hearing about the recent work in Denmark and a number of our faculty presenting at the World Federation of Occupational Therapy conference this past year in Paris. It's really exciting to be a student at a place that is so cutting edge and where the hands-on opportunities in these labs are so extensive. So on the next slide, you'll see how the students have opportunities to engage in our research curriculum. So we are training all students to learn how to use evidence to make decisions in OT practice. So that is first and foremost, we need our students to be able to examine evidence and engage in critical decisions about how to use that evidence to guide their occupational therapy practice. But in addition to that, our students get to then receive mentoring in various research labs from any of our 6 researching faculty. We do have sort of a mentorship model where students are paired in labs, where we are a clinical faculty pair with a research faculty pair for student mentoring. But in those labs, where the faculty are engaging with populations that are sort of the main focus of their research, where they are in hospital settings or they are testing assessments that are potentially going to be used in occupational therapy. Those are the students who are out in those sites with support of the faculty and support of the team. We also have a number of PhD students who also do help support the OTD students. But together, the student populations are those that are the teams that are gathering the evidence and disseminating and sharing at conference levels and beyond. So I'll move to the next slide, where you'll see how within each of these labs, these are photos of students engaged in various practices, things happening in the labs that result in that direct hands-on experience with various populations of individuals across the lifespan. So one of the photos on the top page is actually a photo of a slide from our national conference a few years back. But again, this is at the American Occupational Therapy Association conference, where a new assessment is being presented and shared. And these are our OT students at Wisconsin who are part of learning how to give the assessment and then do the examination on the effectiveness of this assessment and if it is something that will be used in occupational therapy practice. So it's just really neat to be in these labs that provide these various levels of experience, and students do have a choice as far as which research lab they feel is the best fit for them. And so we really hope it is a great experience for all of our students at Wisconsin. On the next slide, You'll see then that our students are presenting at national conferences and beyond. These are some of our students with research posters at our national conference. We've also had students who have been involved with multiple publications, various conferences on campus, and not only just within the profession of occupational therapy, but also interprofessional conferences, interprofessional journals, and conferences beyond, from neuroscience to autism to occupational science. So it's really neat for our students to be involved at this level. So on the next slide, we'll take a peek at our leadership thread. So in our leadership and professional skills courses, students are really gaining that next level of training where, yes, they are going to be really well-trained, evidence-based, strong clinicians, and now they're going to learn how to be leaders in the field of occupational therapy. And so you'll see 20 credits of leadership is significant. And again, that's kind of a major aspect point that sets our OTD program apart, with opportunities to gain skills in advocacy, potential future opportunities for roles in teaching, roles in management, learning how to consider the trends in practice and how to be abreast of those changes, and how to be forward thinking and really critical in their skills to analyze and determine how they see themselves as leaders in the field. And so we really like to foster these experiences within our curriculum. And again, those professional skills courses start right away. So it's training some of those opportunities, thinking about how we connect with our clients early on, but then building the leader throughout the 3 years of time that our students have with us in our OTD program. So we'll see on the next slide. We'll learn a little bit more about our doctoral capstone experience. Dr. Rortvedt, would you like to introduce yourself?
Thanks, Dr. Ebony. Good afternoon, everyone. I'm Dr. Dan Rortvedt. It's very nice to meet you. I'm an occupational therapist, clinical assistant professor, and the capstone coordinator for our program. I'm very passionate about capstone. And as you may know, it's one of the distinguishing factors between an OTD and a master's level degree. I'll be brief today, but we'll try to answer some of these who, what, where, when, why questions regarding how we run our capstone, because every OTD program does it just a little bit differently. We all operate under the same standards. Capstone is squarely in that leadership thread, but it also crosses into all of our curricular threads. And really what you're doing in year 3, your final semester of the curriculum on capstone, is weaving all those threads together, synthesizing and applying the skill set that you've developed during your 3 years in the program, and going out to collaborate with a community partner and meeting a direct need that they have, and developing a program, addressing a need in collaboration with that community partner, and really learning about that process, because you'll engage in that process throughout your career as an occupational therapy practitioner, wherever you end up, whether you're in clinical practice, research, out in the community as a leader. So if we can move forward to the next slide, we'll talk a little bit about this image is sort of an interesting image, thinking about capstone at the top of the mountain, but also the journey up that mountain. So just a brief metaphor there as we launch into the next slide and look at some specifics. One of the things that students sometimes think, and one of my conversations with community partners is around capstone, is that it's not a third fieldwork opportunity. It's different than a fieldwork experience on a level 2 placement. So in your level 2s, you're learning the ins and outs of being an OT, you're learning how to carry a caseload. On capstone, you're sort of zooming up a little bit and thinking about processes, systems. What are some changes that might be made within an organization to make things operate more smoothly, to contribute to a better experience for the clients and the communities that our community partners serve? And you're certainly doing some active listening, thinking about going to that community and making that change in context. But that's really what it all is all about, is using those leadership skills, using those collaboration skills to contribute to a meaningful program development for an organization. As you'll see on the bottom of the slide there, and I'll put them in the chat here as well, we focus on 5 capstone focus areas. When students submit their capstone preference rankings, this is what we have them first think about. Some of our students are really interested in being advanced level practitioners, specializing in a certain facet of OT practice. Some are very interested in potentially teaching or developing continuing education courses for OT practitioners. Some might be interested in starting an OT program, maybe where there are no occupational therapy practitioners present. So So maybe interested in research and leadership and advocacy. So we have different capstone threads or focus areas to align with your interests in your career path as a student. And we work really closely with you to find the best match. You'll submit a preference ranking for your capstone sites along with these focus areas. So really briefly, let's take a look at the next slide here and look at the flow. So as I said, capstone process, the experience itself is during our last semester in spring of year 3, but we talk to you about capstone throughout your time in the program. If you do decide to join us, that first summer orientation, you get oriented to the big picture of capstone. And then we have touch points throughout the curriculum where we slowly unfold and put the puzzle pieces together for you around what that capstone will look like itself. We do value sustainability for our capstone partners, and we hope that year to year, our students on capstone will contribute something that can be followed up on by the cohort behind them. So we have curated a smaller group of capstone partners who we hope we can return to year to year to meet some of those needs in the community. And we'll have some great examples of that very soon. We have our current cohort is doing their capstone planning this fall in preparation for their capstone experience this spring. So lots of exciting things going on within that leadership thread, and we'll throw it over to Dr. Gartland for the wellness component.
Great. Thank you. Yeah, so lastly, our one of our main curricular threads that we decided was really important to us is wellness and health promotion, and focusing not just on kind of disability and after disability events, but really how does human occupation impact our sense of wellness and well-being. So we start right out of the gate with a course that, a 1-credit course that helps you approach your whole time in graduate school thinking about what do I need to end in 3 years still centered and healthy. And our hope is that you go on to be not only a practitioner that thinks about these things, but also has some tools for you personally to prevent burnout. That is something that is really big in healthcare right now, as you may have heard, especially post-COVID. Is there a next slide? I'm sorry. Can you switch? Great. I'm going to pass it on then to Lexi. Or am I supposed to talk about this, Lexi? Sorry.
I'm happy to. It's all good.
Okay, go for it.
Yes, absolutely. So our students do have the opportunity to engage in some really unique experiences while they are with us on campus. So while we do have a very small cohort model and a high level of support, faculty to student ratio, we are also centered at a very large research university, a large university that has multiple opportunities for student involvement in student organizations. And so within our OT program, we do have the Student Occupational Therapy Association, SOTA, which has a professional development focus where students are gaining networks and partnerships, doing community service involvement, contributing to our pro bono clinic, various opportunities for networking and career development. We also have the Diverse OT Student Organization, which is actually a really unique model in that this organization is available to undergraduate students and occupational therapy students together to really build a supportive pathway to build a more diverse profession in occupational therapy. We want our students, and within this organization, the students spend a great degree of time focusing on becoming culturally responsive caregivers and learning about one another and the needs of society. So really through that public health lens as well. And so these are opportunities we have directly within our program. We also then on campus, between the interprofessional opportunities and the student organizations, there are just so many ways for students to connect with others who share similar interests and really have a great time on campus. So on the next slide, I'm going to let Dr. Gartland share a little bit more about her work with the Center for Interprofessional Education and this really unique opportunity for interprofessional practice we have in our curriculum as well.
Yeah, thank you. We really appreciate being at a well-resourced university. And one of the cool things about being at UW-Madison is that we have a Center for Interprofessional Practice and Education. So all of our students will be a part of getting training along with students from the nursing program, pharmacy, medicine, PT, social work, genetic counseling, on and on, public health. And it's just a wonderful opportunity to learn how to work together as a team for the best outcomes for the people we serve in healthcare. And then if you get excited about interprofessional education, you can continue to participate in future things. We've got a picture here of Go Baby Go, which is a partnership with the engineering program and PT and OT, helping remodel certain toy cars for kids with disabilities, which is a super fun event each year. And next slide is we just have a big vision of the kind of student that we want to graduate from here. And these are just a few of the distinctives when we started dreaming about who should be here and the kind of student that will be an alumni of our organization. It's centered around occupation, but a really rich, diverse understanding of human occupation. Really valuing people's capacity rather than their condition. So not a real medicalized viewpoint of them. We're looking for students who are comfortable with risk, creativity, and innovation, skilled in critical thinking and evidence-based practice, and finally, strong sense of ethics, inclusivity, and professionalism. So I think that's already happening. We see that in our students, and we look forward to seeing the great things they'll accomplish as they go on into the future. Next slide.
All right. So to wrap us up here, if you do feel that you are ready to consider UW-Madison, I do have our admission criteria listed here. You'll notice that the GRE is not included in our criteria, and that we really take a lot of different experiences into consideration when preparing for a future in OT. I would like to add that we also do have a free course for hours of observational experience. I'm going to pop that in the chat right now, in addition to our website, which will guide you on how to apply to our program. We are accepting applications at this time for summer 2024. So it is, admission is already open, and please feel free. We do utilize a rolling process. And so again, we're accepting at this time up until November 1st.